Esophageal cancer or esophageal cancer refers to cancer that occurs in the esophagus, the long tube that carries food from the throat to the stomach. This type of cancer can develop in any part of the esophagus but is most commonly found in the lower section. It is a serious condition that can lead to significant morbidity and mortality if not diagnosed and treated early. Types of esophageal cancer. There are two main types of esophageal cancer. Adenocarcinoma. This type arises from the glandular cells in a lining of the esophagus and is the most common form in the United States. It often occurs in the lower part of the esophagus and is associated with conditions like gastroesophageal reflux disease (GERD) and Barrett's esophagus. Squamous cell carcinoma. This type arises from the flat cells lining the esophagus and is more common in other parts of the world, including parts of Asia and Africa. It typically occurs in the upper and middle sections of the esophagus and is often associated with risk factors like smoking and alcohol consumption. Risk factors. Several factors can increase the risk of developing esophageal cancer, including age. Most cases occur in people over 55 years of age. Gender. Men are more likely to develop esophageal cancer than women. Obesity. Excess weight increases the risk of adenocarcinoma, particularly due to its association with GERD. Tobacco use. Smoking increases the risk of squamous cell carcinoma. Alcohol consumption. Heavy drinking is a significant risk factor for both types of esophageal cancer. Diet. A diet low in fruits and vegetables and high in processed meats may increase risk. Chronic reflux. Conditions like GERD can lead to Barrett's esophagus, increasing the risk of adenocarcinoma. Barrett's esophagus. This condition, characterized by changes in the cells lining the lower esophagus, can develop due to chronic acid exposure and is a significant risk factor for adenocarcinoma. Previous radiation therapy. History of radiation treatment to the chest or neck may increase risk. Symptoms of esophageal cancer often develop gradually and may include difficulty swallowing, dysphagia, a sensation of food being stuck in the throat or chest, unintentional weight loss, significant weight loss without trying, often due to difficulty eating, chest pain or discomfort. This may feel like a burning sensation or pressure in the chest, persistent cough or hoarseness. A chronic cough or changes in voice may occur. Heartburn or indigestion. Persistent acid reflux symptoms, particularly in those without a history of GERD. Vomiting. This may include vomiting blood or material that looks like coffee grounds. Fatigue. General feelings of tiredness or weakness. These symptoms can also be indicative of other conditions, so it's important for individuals experiencing them to seek medical evaluation. Diagnosis of esophageal cancer typically involves several steps. Medical history and physical examination. The healthcare provider will inquire about symptoms, risk factors, and medical history. Endoscopy. A thin, flexible tube with a camera endoscope is inserted through the mouth to visualize the esophagus. This procedure allows for direct observation and can be used to take biopsies tissue samples. Imaging tests. Imaging techniques such as CT scans, PET scans, or MRI may be performed to assess the extent of cancer and check for metastasis spread to other parts of the body. Biopsy. The sample of tissue is obtained during endoscopy and examined under a microscope to confirm the diagnosis of cancer. Staging. Staging determines the extent of cancer spread, which is essential for treatment planning. The most commonly used system is the AJCC American Joint Committee on Cancer Staging System. Treatment for esophageal cancer depends on the stage of the cancer, its location, and the patient's overall health. Treatment options may include surgery, esophagectomy, removal of part or all of the esophagus, often with reconstruction to allow for normal swallowing. Endoscopic resection. For very early stage cancers, the tumor can sometimes be removed through endoscopy. Radiation therapy. High-energy rays are used to kill cancer cells or shrink tumors. It may be used as a primary treatment, adjuvant therapy after surgery, or palliative care to relieve symptoms. Chemotherapy, the use of drugs to kill cancer cells, which may be used before surgery. Neoadjuvant chemotherapy to shrink the tumor, after surgery. Adjuvant chemotherapy, or as the main treatment for advanced cancers. Targeted therapy. These drugs specifically target cancer cells' unique characteristics. For example, trastuzumab Herceptin is used for esophageal cancers that overexpress the HER2 protein. Immunotherapy. This treatment helps the immune system recognize and fight cancer cells. It is being investigated for certain cases of esophageal cancer. Palliative care. For advanced cases where the cure is not possible, palliative care focuses on improving quality of life and managing symptoms. Prognosis. The prognosis for esophageal cancer varies widely based on several factors, including the stage at diagnosis, tumor type, and overall health of the patient. The 5-year survival rates for esophageal cancer are as follows. Localized stage cancer confined to the esophagus, approximately 44% survival rate. Regional stage cancer spread to nearby tissues or lymph nodes, approximately 24% survival rate. Distant stage metastatic cancer spread to other parts of the body, approximately 5% survival rate. Prevention. While not all cases of esophageal cancer can be prevented, certain lifestyle changes and risk factor modifications can help reduce the risk. Maintain the healthy weight. Achieving and maintaining the healthy weight may lower the risk of adenocarcinoma. Avoid tobacco. Quitting smoking and avoiding tobacco products significantly reduce the risk of esophageal cancer. Limit alcohol consumption. Reducing or eliminating alcohol intake can lower the risk, particularly for squamous cell carcinoma. Healthy diet. Consuming a diet rich in fruits, vegetables, and whole grains may reduce the risk. Manage reflux symptoms. Effective management of GERD and regular monitoring of Barrett's esophagus can help reduce the risk of developing adenocarcinoma. Conclusion. Esophageal cancer is a serious condition with significant implications for health and quality of life. Awareness of risk factors, early recognition of symptoms, and prompt medical evaluation are critical for improving outcomes. Advances in treatment options and a multidisciplinary approach can provide better management and care for individuals diagnosed with this disease. Regular medical check UPS, especially for individuals with known risk factors, can aid in early detection and management.